It is one of the most frustrating and confusing experiences a man can go through, wanting to be intimate, but finding that the body is not cooperating. For many, this can feel like an isolated problem, leading to worry, embarrassment, and even strained relationships. But the reality is that millions of men experience this issue at some point in their lives. If you have found yourself in this situation, you are not alone, and the good news is that there are solutions. Erectile difficulties can stem from many different causes, including physical health, mental well-being, and lifestyle choices. Understanding what is happening and how to address it is the first step toward regaining confidence and control. If you haven't subscribed to the channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated with our latest content. Also, don't forget to like and share this video. In this video, we will explore the potential reasons behind this issue and the best steps to take toward improvement. So, why does it happen? Erectile function is a complex process that involves the brain, nerves, hormones, blood vessels, and emotions. When something disrupts any part of the system, the result can be difficulty achieving or maintaining an erection. Below are some of the most common reasons why this happens. 1. Blood flow problems. The penis requires adequate blood flow to become and stay firm. Conditions such as high blood pressure, diabetes, high cholesterol, and heart disease can restrict circulation, making erections difficult to achieve. 2. Hormonal imbalance. Testosterone plays a key role in sexual function. Low levels of this hormone can lead to reduced desire and difficulty with erections. Other hormonal imbalances, such as thyroid disorders, can also contribute. 3. Mental health and stress. Anxiety, depression, and chronic stress can interfere with sexual performance. The mind and body are deeply connected, and psychological concerns can create a cycle where worry about performance leads to further difficulties. 4. Lifestyle choices. Smoking, excessive alcohol consumption, poor diet, and lack of exercise all negatively impact circulation and nerve function. Unhealthy habits can lead to long-term erectile difficulties. 5. Nerve damage. The nervous system plays a critical role in arousal and erection. Conditions like diabetes, spinal injuries, and surgeries that affect nerve pathways can contribute to difficulties. 6. Medications and side effects. Some prescription drugs, including those for high blood pressure, depression, and allergies, can interfere with erectile function. If you suspect this is the cause, discussing alternative medications with a healthcare provider may help. Steps to improve erectile function. Now that we understand potential causes, let's explore effective solutions. Addressing the issue involves a combination of physical, mental, and lifestyle adjustments. 1. Prioritize heart health. Since erections depend on good circulation, taking care of your cardiovascular system is essential. This includes eating a diet rich in fruits, vegetables, lean proteins, and healthy fats while minimizing processed foods and excess sugar. 2. Exercise regularly. Engaging in physical activity, especially cardiovascular exercise, helps improve blood flow, maintain a healthy weight, and boost testosterone levels. Strength training can also be beneficial for hormone balance. 3. Manage stress and anxiety. Finding ways to manage stress can make a huge difference. Techniques such as meditation, deep breathing, therapy, or even engaging in hobbies that promote relaxation can help break the cycle of performance anxiety. 4. Get quality sleep. Poor sleep habits can disrupt hormone production and increase stress levels, both of which negatively impact sexual health. Aim for 7 to 9 hours of quality sleep per night. 5. Evaluate medications. If you suspect that a medication is affecting your performance, consult a doctor about possible alternatives. Never stop taking prescribed medications without medical guidance. 6. Limit alcohol and avoid smoking. Alcohol can reduce testosterone levels and interfere with arousal, while smoking damages blood vessels, restricting circulation. Cutting down or quitting can lead to noticeable improvements. 7. Consider supplements. Certain vitamins and natural supplements may support erectile function. L-arginine, zinc, vitamin D, and ginseng have been studied for their potential benefits. Always consult a healthcare professional before trying new supplements. 8. Seek professional help when needed. If the issue persists despite making changes, consulting a doctor is important. Medical professionals can assess underlying conditions and recommend treatment options, including medication or therapy if necessary. Experiencing difficulties with erections can be frustrating, but it is often a sign that the body is asking for attention. Taking proactive steps to improve overall health, manage stress, and seek professional guidance when necessary can lead to better results over time. The key is to approach the issue with patience, a willingness to make positive changes, and an understanding that solutions are available. If this video has helped you, then don't forget to hit that subscribe button and turn on the bell so you never miss life-changing health tips. See you in the next video.